First place to start is just to talk to us about the NGO and the work that it does.
So our organization is called Ilifa Labantwana, and we work to secure an equal start for all children living in South Africa by ensuring that through universal access, they can access quality early childhood development. So our program is it's a national program, and what we do is we try to work with government. We first of all demonstrate certain programs that respond to barriers that are there in the government system, and then we try to work together in partnership with government after we found evidence and data that really supports our arguments, and then we engage the government on the solutions that we would have found.
I want to talk about the funding that you secured from the ELMA Foundation, Allan, Orbis, DG Murray Trust and Standard Bank. But before I get to that, I just want to kind of delve a little bit deeper into what the plight of children is like at the moment in South Africa, and what are you discovering on the ground?
Okay. So right now in South Africa, because of the COVID-19 pandemic, we're finding that children have been threatened by acute hunger. Children don't have last year ECD programs were facing a closure because there wasn't a proper plan for the sector to reopen. And the ECD workforce was really struggling because parents were not sending their children to school. Therefore, there was no income that was coming into ECD programs. So the sector really was on its knees, and it was crippled because there wasn't any kind of support that was really coming through for the ECD sector.
First of all, congratulations on your funding round. But
yes.
Now that we find ourselves 2 years into this pandemic, and I must admit that we do find a lot of people that are playing in the ECD space. But how is this focus by Ilifa Labantwana different to what other organizations are doing within the ECD sector when it comes to children?
You know, we had this really great opportunity from our four funders, and we're really grateful for the opportunity that they gave us to be able to provide a humanitarian relief to ECD programs. And we decided to particularly focus on unregistered ECD programs because these programs are not receiving any kind of support from the government or from anyone. And you know, these programs are reaching the most vulnerable children. We know that there are about 1 million children that are in these unregistered ECD sites. So they're not getting any kind of support. And what is different about what our organization is doing is we didn't only just provide humanitarian support, but what we did is we also wanted to learn from the process or from the experience of supporting these unregistered programs, and to be able to provide evidence for the government and for the sector in general, even for the private sector that wants to invest in ECD. We wanted to be able to demonstrate certain arguments, right? And one of the things that we were trying to show is that ECD NGOs are able to reach and support unregistered sites. The government has a responsibility to reach all to provide quality ECD services. And currently, they're not reaching all of the ECD sites. Currently, there's only a small proportion that is registered and known to the Department of Social Development. So we wanted to demonstrate how they can even reach more unregistered sites. And also we took this opportunity to test an innovative digital voucher system that we thought is a great opportunity to show other methods of funding ECD, especially targeting nutrition.
And the interesting thing, I just want to jump in there, and I think
Yes,
what you're saying is so interesting because these unregistered ECD centers, just because they have not followed the process for whatever reason, or in different levels of acquiring the correct documentation or wherever they may be, doesn't mean that they don't serve the community.
exactly. Um, these places are reaching a lot of children who are vulnerable. And the thing is that there are barriers, there's systemic barriers that actually prevent these ECD sites from registering. What we found in
Like,
our project is like the registration process. ECD sites have to meet certain zoning requirements, which means that they have to pay thousands of rands for that process of application to local government to be able to demonstrate that they are located in a place where ECD services can be provided. So sometimes they have infrastructure barriers. If your ECD site is not built properly, then you can't get a registration certificate from an environmental health officer. So all of these things are affecting these people, and we know that these unregistered programs are really supporting and providing early learning in their communities. And
yeah.
they're doing great work, but it's just that because they can't meet these standards
Yeah.
that have been set up.
Sitimbile, there's a saying, and I'm 100% sure you're familiar with it. It's better to teach somebody how to fish than to give them a fish. Is part of your program, and might not be part of the mandate, but how does a program like this get those unregistered ECD centers on a road to get registered? Because surely they would, at the end of the day, even though they are doing an amazing service, they would still be better off being registered.
Yes, they would be, but what we want to argue is that the government needs to support these ECD sites and that they need to have a developmental approach to registration and not to just set the bar very high. And we have many children who are living in informal settlements, in sometimes in the most rural contexts where like even the basic thing of providing a fence around your ECD site is such a difficult thing to be able to afford and to do. So we want the government to have a developmental approach in supporting these ECD sites. And also, like, what happens to these children?
Yeah.
The government has a responsibility to provide nutrition also in for younger children. And by excluding these unregistered programs, then it means you're also excluding, you're refusing to support them to access nutrition.
So they
And
must
in
be,
South
yeah.
Africa, sorry, and I just wanted to say that in South Africa, our stunting rate is very high. It's at 27%. And the government can play a role in trying to mitigate the impact of the results of malnutrition and actually improve early learning outcomes for children
And
by the time that they get to school.
yeah, and it also if you as an organization were able to verify and visit those sites and see with your own eyes the impact. At the end of the day, the kind of monitoring and evaluation system for unregistered ECDs should be, listening to what you're saying, should be relaxed, because if you've got body of evidence, I assume then that you would be able to say, well, as an example, we can see Sam is running an ECD center. We can see how many kids Sam is feeding on a daily basis. So therefore, they should get funding, and it shouldn't be based on the amount of paperwork, how many correct answers they give to difficult questions that they sometimes don't understand.
Yes, no, I totally agree with that. And what we found is that ECD NGOs can play a role in supporting the government to be able to verify the ECD sites, to verify the number of beneficiaries, the number of children, to verify who exactly is working in these sites. These ECD NGOs already have networks. So we worked with Smart Start, VPUU, and the Unlimited Child. And these organizations already have networks within them with ECD programs. So they are able to quickly identify and to provide the information and data that's required to convince the government that these people are indeed existing and that these are the challenges and this is their reach. And they also, we also found that they played a crucial role in the actual monitoring. And these, sometimes people think that these ECD sites don't want to be known. But what we found when we actually implemented this project is that these people are really, they want to get support. They want to comply. And if they're given the right support and assistance, they will be able to meet the requirements and to ensure that children continue to thrive.
Yeah. I just wanted to ask, obviously it's in your interest. I mean, 36 million only goes so far. It's not an infinite resource. Money isn't, in actual fact. And you've got 4 companies that have come together as your strategic port partners here that have come. That's the ELMA Foundation, Allan Orbis Foundation, the Standard Bank, Tutuwa Community Foundation, and DG Murray Trust. That's 36 million. How far does 36 million get you if you don't get some of these unregistered ECD centers to become registered and to get proper funding from government, or at least line them up to get proper funding?
Yeah, it can only get to you to a certain point, totally agree with what you're saying. And what we want is for the government to be able to amplify their reach and to collaborate with the sector. ECD organizations are they are willing to work, to collaborate, to support the sites that they are working with on the ground, because they really understand the difficulties that these sites are facing, and they are able to leverage. The government will be able to leverage off the relationships that ECD NGOs have with ECD programs. So it's a really, if government would collaborate more with the NGO sector in ECD, they would be able to really reach a lot of children that are in far off places.